C1 and C2, and which are the atypical ones, meaning they are a bit different from the other cervicals. First, we are starting with C1, and it has a name. It's called Atlas. And the one thing that makes this different from the other cervicals is that it does not have a body. I had a typical one here. You can see the body of the other cervicals, and in here it does not.
So that's one. It doesn't have any body. What
Yes.
that doesn't have? What else?
It does not have a spinous process
Right. It doesn't
as
have
well.
a spinous process.
Yes, and then to look at we have some other structures in here.
Mhm.
We have the superior articular facets, which goes with the occipital condyle of the occipital bone, and
it
I
sits
think
like so.
yes. So this is how
Right.
it's like.
That's how it sits.
Yes, and then we
So you have a joint, what we call as the
this is called the occipital joint. Yes. And then
And that atlanto-occipital joint. So what type of functions or movement does occur around that joint? Right. It's just like flexion, extension,
Yes.
or nodding, saying yes, saying yes.
okay, so
Nodding forward and backwards.
and then we have, as we said, we do not have the spinous process, but we have the anterior tubercle and we have the posterior tubercle, and we have the transverse processes, and of course we have the transverse foramen, and we have the vertebral foramen.
What else? We also have another thing there.
Yes, we also have a facet inside in here, and this is the facet for the dens, or for the odontoid process of the C2.
Fovea dentis.
Yes, it's called fovea dentis, and
Or facets for the dents.
yes.
And we forgot to talk about lateral mass.
Yeah, I am getting there. We have the lateral masses on the lateral side, obviously, as the name suggests. And we also, as Rena and Professor mentioned earlier, we have the artery, the spinal artery, the groove for the spinal artery.
Vertebral artery.
Yes, for the vertebral artery, which is here. And
Okay, let's show you that. Okay, so these are the groove. You see this groove here on either side. One on the left, one right. This is the groove for the vertebral. So vertebral artery goes like this. It goes like this on either side, and it basically curves around. So it goes through it, and it curves around here, curves around, and then goes up through the foramen magnum, both on the right side and on the left side. So this is a groove for the vertebral artery. Okay, groove for the vertebral artery. Okay.
thank you.
And then, so the fovea dentis basically sits like this. You see, the dents or the odontoid process.